Hi everyone, in today's video we are going to be talking all about asthma, including what it is and how to support those with the condition. So let's get started. So to begin, what is asthma? Asthma is a chronic respiratory condition that affects millions of people worldwide and is characterized by inflammation and narrowing of the airways, which causes breathing difficulties. The most common asthma triggers include pollen, dust mites, pollution, smoke, and respiratory infections. Understanding triggers is crucial for managing asthma effectively. So being able to identify which triggers set off your asthma is crucial in figuring out how to mitigate the symptoms of your asthma. The most common symptoms of asthma include coughing, chest tightness, shortness of breath, and wheezing, which can often be heard when taking a deep breath in or deep breath out. The wheezing is caused by the narrowing of your airways, and symptoms can vary in severity and frequency among individuals. Now, sometimes asthma and allergies can be confused with one another, so to understand their differences, we must first look at the underlying mechanisms of each. So again, for asthma is a chronic respiratory condition that's characterized by inflammation and narrowing of airways that leads to breathing difficulties. On the other hand, allergies are immune system reactions to specific substances, otherwise known as allergens, that are usually harmless to most people. Allergic reactions can manifest as sneezing, itching, nasal congestion, and rashes. It is true, however, that some people can have severe allergies that require them to carry medication and EpiPen with them in case they go into anaphylactic shock. The treatment approaches for asthma compared to allergies also differ a little bit as well. So when we look at asthma, inhaled medications are typically used to relieve symptoms along with corticosteroid medications to reduce airway inflammation. When we look at treatment approaches for allergies, they focus on avoiding allergens whenever possible, and they may also include medications such as antihistamines, decongestants, nasal corticosteroids, and allergen immunotherapy, which are allergy shots that desensitize the immune system to the specific allergen. To further elaborate on the diagnosis and treatment of asthma, when we look at the diagnosis of asthma, it typically involves taking a medical history, doing physical exams, as well as assessing your lung function. And these tests are typically done by your physician. Again, the treatment of asthma typically includes medications such as inhalers and corticosteroids, lifestyle changes, and avoiding the triggers that cause your asthma to be exacerbated. With inhalers being one of the most commonly prescribed medications for those who suffer from asthma, it's important to know how to properly use an inhaler. So I'm going to briefly take you through the steps on how to do so. If you're using a basic inhaler without a spacer, you remove the cap and shake the inhaler well. Hold the inhaler against your mouth with the top of it facing upwards and hold it so you can place a finger on the button on top of your inhaler. You're then going to exhale all the air you can from your lungs completely. And then you're going to create a seal by placing the inhaler between your teeth and closing your lips fully around the mouthpiece. Then inhale slowly and deeply while pressing down on the canister, the button on the end of your inhaler, to administer the medication. You should then try to hold your breath for 5 to 10 seconds to allow the medication to reach your lungs. Then exhale slowly with the inhaler away from your mouth and wait before taking the next dose if you require more than one dose. It's also important just for oral health to rinse your mouth afterwards if necessary. A common question a lot of people have is, why do some people experience asthma while others do not? So A variety of factors contribute to whether or not an individual will experience asthma, one of them being genetic factors. So, asthma typically tends to run in families, which suggests a genetic predisposition. Environmental exposures are also factors that can contribute to one's development of asthma. So, exposure to allergens such as pollen, dust mites, etc., can trigger asthma symptoms in susceptible individuals. Immune system response is another factor, so individuals with an overactive immune response may be more prone to developing asthma. Finally, lifestyle and behavior can contribute to your development of asthma, so factors such as smoking, obesity, and exposure to certain occupational hazards may increase the risk of developing asthma or exacerbate existing symptoms of the condition. Now, in honor of World Asthma Day, we want to advocate and raise awareness about the condition to help those who suffer from asthma. So, World Asthma Day aims to raise awareness, educate communities, and advocate for better asthma care. And collaborative efforts from healthcare professionals, organizations, and individuals are crucial in allowing this to happen. So, how can you help? You can help by encouraging those you love who exhibit signs and symptoms of asthma to seek support from a physician if they have not already. You can also educate yourself on proper inhaler use to help loved ones in the case of an emergency, and you can share information to support asthma awareness and advocate for the condition.